I will show you only some part of the very comprehensive survey among men having sex with men conducted in 2013, because we conduct actually this survey in 3 towns, or in capital Belgrade, but also in 2 big towns, bigger towns like Novi Sad and Kragujevac. In Serbia, since the beginning of the HIV/AIDS epidemic, which started in 1984, before more than 30 years, we actually, based on surveillance data, registered more than 3,000 people diagnosed with HIV, and among them, 1/3 was among men having sex with men. The majority of cases actually was registered in Belgrade, but the situation is changing. But also in the last 10 years, the transmission HIV was predominant among men having sex with men, which means that every year 40% to 66% of all newly diagnosed cases are among men having sex with men. As second part, and as part of second generation on HIV surveillance, we actually conducted within a global funded HIV program, conducted and implemented by the Ministry of Health, National Institute of Public Health, together with academic institutions and NGO sector, conducted 4 cycles of integrated biobehavior or behavioral survey among defined most at risk populations, including men having sex with men. We also conducted surveys among ID users, sex workers, prisoners, young Roma, and institutionalized children. And these surveys was conducted in 2008, 2010, 2012, and 2014. I will present you, as I said before, only some data, some results from the survey conducted in Belgrade among men having sex with men. The main objectives of the part I will show you, it was to estimate HIV prevalence among men having sex with men in Belgrade, to estimate the prevalence of risky sexual behavior and voluntary counseling and testing practice on HIV among men having sex with men, and also it's very important to monitor the trend of risky behavior and HIV prevalence among MSM in Belgrade, which was the capital city, and we planned actually to conduct the surveys every 2nd or 3rd year at minimum in Belgrade. By methodology, by type of study, it was cross-sectional integrated biobehavioral survey. The field part of the survey was conducted during November to December 2013. And the target population was defined as men aged 18 to 59 living in Belgrade at least 3 months who had anal sexual intercourse with the men in the last 6 months. We applied, as Vladimir said and others, we applied actually the respondent-driven sample methodology, which was the modified snowball sampling methodology, but we have the sampling frame. So to be as much representative as it could be, we recruit initial 10 people, 10 MSM as seeds from based on the 4 main identified ways how they find a sexual partner. So first group of the MSM we recruited seeds was they find partners over e-media, like internet chat or announcement. Second, who find a partner in clubs. Third group was in parks, in public toilets. And the last 4 group was through personal contacts or on private parties. We applied standardized questionnaire who was self-administered by participants and supported if they need by the field researcher. For the biological part of the survey, we actually used rapid HIV tests. We conduct our survey out of health facility in the private place because MSM is highly stigmatized in our country. And we actually have pre-test counseling for every participant and testing of the finger tip blood. And it was for the estimates of HIV prevalence. Those who are interested to know the results, it was post-testing, and also those who are interested to know have referral to go further to be diagnosed as they are HIV infected or not, because it was only the screening, of course, screening method. And we, for the statistical analysis, we use SPSS and RDSAT. I will not tell you more because Vladimir explained everything. But why? We actually calculate using the RDSAT estimated population proportion, not only the estimated sample proportion, which was computed by SPSS. The results, actually the sample size was 200 eligible participants. Median age was 30 years. Only 1% is reported as transgender, which was very interesting for us, so we go no further analysis because of the small percentages of those, but we are interested to know more about that part of the population. As we expected, 82 reported that they are single, but 7% is reported they are married, and even 5 they are divorced. Also, it was very impressive that 97% of our respondents reporting having secondary or higher level of education. Median age at first anal sex with other men was 19 years. And the median number of male sexual partners in the last 12 months was 6. Regarding the fact how many reported having oral sex, the majority, almost all, reported having oral sex, but only 76 of participants reporting never using condom during the oral sex, which is the higher prevalence comparing to the previous survey than when 55 reported never using condom during the oral sex. 38% reporting having vaginal sex with a female partner ever, but every 9 reporting having sex with females in the last 12 months, and among those who have sex with a female in the last 12 months, in the last year, 1/3 reported always using condom with female partner, which is the risky behavior we recognized. 62% of our participants reporting using condom during the last anal sex. But it is the same, sample proportion is the same as estimated population proportion using RDSAT. But on the graph, you can see that if you are looking from the results on the previous surveys conducted, this indicator using condoms during the last anal sex showed a stable trend, which is not good because our target for 2015 was to 80% of MSM using condom during the sex, which is not the situation, and this is the results which are worried about. But if you are looking to find how is there some discrepancies regarding the type of partner and always using condom practice, we notify the big discrepancies. So every 3rd MSM who have sex with a steady partner reporting always using condom. 60% of those who have sex with a casual partner reporting using condom, and the majority, 85%, reporting using condoms with those who are paid for the sex, who had commercial sex. But at the other side, only 2 respondents reported that they have paid for the commercial sex. Also, I want to show you the results that suppose it's that almost half of the participants reporting having sex under the influence of alcohol in the last 12 months, which is the same results as we notified in the previous survey. And 7.5, which is not so high, percentage is reporting using illegal drugs, and of those who are using illegal drugs, 2% is reporting that use drugs by injecting, And almost all of them reported that always using sterile equipment when they inject the drugs. Regarding the practice of testing on HIV, more than one-third of participants, 36%, is reporting being voluntarily tested on HIV and to know the results on testing in the last 12 months. Which, based on the previous results from the previous surveys, we notified the slightly increasing trend of HIV testing practice, but still far away from the target we want till the end of 2015, that 55% of MSM have been testing in the last 12 months. Estimated HIV prevalence among sampled MSM in this year, or in 2013, was actually more higher than we expected. It was 8.3%, and estimated population proportion was even high, 9.2%. If we look at the graph, we can see that there is increasing trend of HIV prevalence among having sex with men in Belgrade, and this is not significant because the confidence time interval are overlapping, but we are worried knowing that the estimated size of MSM population in Serbia, which was for 2010, it was 55,000 MSM, and in Belgrade we estimated more than 10,000 MSM. If we are looking our data, we can have impression that something is wrong with HIV in MSM population, so we need to be focused on it. Also, we have information that our participants, 13.5, reporting that have signs and symptoms of some STIs in the last 12 months. The main limitation of survey was the sampling methodology. As I said, we try to be as much representative as we can, but it is not possible for the hidden population or stigmatized population such as MSM to have the random sampling, etc. So this is the one limitation of the survey. And also its social bias, data related on self-report behavior, and socially accepted answers may apply. As conclusions, our findings highlight the presence of high risky behavior and low level of HIV testing practice among men having sex with men. Even we have a lot of voluntary counseling centers in the health facilities like all public health institutes in Serbia. Also, we conducted testing out of the health facilities using rapid tests in cooperation with the NGOs. We are not satisfied of the level of knowledge how it's important to be tested and to know HIV status in this population, which is our key population. Now, based on data, and also our surveillance data suggests the HIV epidemic is currently concentrated among this population. And as I said, this is the key vulnerable and most at risk population for HIV in Serbia, because our results for other populations like ID users and sex workers show us that the HIV prevalence is lower than 2 in these populations. But as MSM, as I said, we found 8% and maybe more. So our imperative is to work on attitudes among MSM to change their behavior, if it is possible, to know what has happened. And also, even we have in the previous year HIV projects funded by Global Fund and implemented in many cities, including prevention among men having sex with men, some targeted campaigns for this. We are aware that we need to have a sustainable prevention among men having sex with men to be recognized, to be lower stigmatized, and we need to can and must act in a better and most effective way in aim to prevent further HIV transmission in MSM population in Serbia. I would like to acknowledge the Ministry of Health, who are implemented this Global Fund project, HIV, and also academic consultants from the academic institutions and our dear friends from NGO who worked with us all these years, and statisticians, of course. Thank you.
Thank you, Danijela. Now, please, questions or comments, please.
Thank you. Again, a nice presentation, very clear. I was troubled slightly by the graph on condom use with that very large change between 2008 to 2010 and then back to 2012. You know, when you see such, you know, a halving of reported condom rate, one just wonders whether there's been any change in methodology, and particularly if you look at that and the importance that's been stressed on condom use and the trend in HIV, which doesn't show really anything like any correlation with that. I wonder whether you would like to comment on whether there was any change in the methodology around collecting data on condom use. And my other question, which is the same question as I asked one of the previous ones, is what proportion of those that were tested positive in this survey knew their HIV status? And I noticed that you had the option that they wouldn't be given their results. So it'd be interesting to know what proportion of HIV infection appears to be unknown. And for those that were known, are they all on ART?
Okay.
Lots of questions.
Okay, thank you for your questions. 2 questions. I will try to answer you. Actually, we changed the methodology. From the previous 3 surveys, we applied snowball sampling. In 2014, we applied respondent-driven sample. We tried to be as much representative as it's possible. Also, the size sample was lower in this 2010 when we found the lower proportion of those who reporting using the condoms. I suppose it is enough for the explanation, or you wish more. And regarding the second question, it was on... Yeah, actually, they voluntarily participate. It was mandatory to be tested, and the pre-counseling and testing was the mandatory. As I remembered, we did not ask them, are you previously know your status to be reported through the questionnaire? And all those who were interested, I think majority of them were interesting. And I suppose some of them for sure know that they are HIV positive because it was not inclusion or exclusion criteria for the participants. We did not ask them, are you HIV positive or not, when we recruit them. But based on this methodology, it's possible, you know, to eliminate or to correct the homophilia. And those who wants to know, some of them was actually newly diagnosed. They never know, some of them, I don't know how percentages of them, they actually want to know the results, and they were surprised when they found they are HIV positive. But regarding the statistical significance, we actually correlate those who are HIV positive in this survey reporting. We have the statistical parameter that those who are HIV infected 2 times more reporting using condoms than those who are not HIV infected.
That's really helpful to know, but it just emphasizes, I think, the importance of not only active testing strategies, but actually recording whether or not they know their HIV status, because there's a missed opportunity for prevention and for treatment as well. Yeah. And so I think that would be quite a useful statistic or information to present in this kind of presentation in the future.
Yeah, we are actually not satisfied with the number of MSM tested every year. Even we have a lot of sites for those who are. And also we are trying to be focused and to make strategy, how to improve their knowledge, how it's important to be tested, not only one in the life, but even more in the year. Because based on some assumption, the HIV infection, it's more rapidly progressive among men having sex with men than those who are ID users or some other people. Based on the median age they have a sex and other surveillance data, when we compare it, and AIDS cases among MSM, we found that some of them developed AIDS, or even more, they are asymptomatic but have a low CD4, have very progressive HIV infection based maybe on the subtype of virus they acquired.
Thank you.
Thank you a lot. I wanted to ask if you found any differences in risk behavior regarding age, if it's the young group versus the older group.
Sorry, just repeat it because I...
Did you look at risk behavior per age category versus the young group against the older group?
No, no statistical significance between the different ages groups for this indicator I present to you.
Thank you.
Thank you. Please.
Thank you for a wonderful presentation. I have one question because for us epidemiologists, the population size is very important in order to implement the measures. I know from personal experience that it's very hard to make sound estimates. What did you use, do you know, for MSM population size estimates in Belgrade?
Size estimates. Actually, this is the published survey on size estimates. We used different methods like capture, recapture, and multiplier, and some other things. But for the lowest percentages, we used international recommendation that it could be 6% of the population could be infected. So the lowest size estimates was based from the survey data and the methodology I just mentioned, but the highest, we assumed that 6% of population are MSM, and then we found the median, 55,000 in Serbia, MSM.
Thank you.
Thank you. Is there any question, please? No questions. Thank you, Danijela.